All right, Joey, this is something you and I both are interested in, losing a little bit of weight, but maybe not weight loss surgery. But here to talk about your options, Dr. George Woodman of Baptist Memorial. So, Doc, the surgery for weight loss, is that as big as I imagine that it is? It seems like a lot of people are doing that these days.
Well, obesity is occurring in epidemic proportions, and it's not going away. And the fact is, over half of Americans are at least 50 pounds overweight. So more and more people are seeking out surgery. And there's about 93 million people in America that qualify. So surgery is a big step, but a very beneficial step for a lot of people.
So as I think about weight loss surgery, and I know some people have done this, like I said, is this something that is necessary for some people, or could they do it the old-fashioned way?
Well, the fact is most people probably can do it on their own, but we know from experience that about 97% of people, once they become at least 50 pounds overweight, simply are unable to do it without some sort of help.
Okay.
And that's where surgery comes in, and that's why we're so busy seeing patients.
So I understand there's some kind of FDA trial that's happening right now. What's that about, and how are you involved in it?
Well, the most common procedure done around the world is called the sleeve gastrectomy, and that's a surgical procedure through incisions where we take a standard-sized stomach and remove about that much stomach, so we don't rearrange anything, and it's a very successful procedure. The FDA trial involves a new technique and a new instrument by USGI, and through that we can go down through the mouth endoscopically without making incisions, and with that procedure make the stomach smaller from the inside. And so the hope is that this technique and procedure called a pose procedure can help make patients satisfied with a lot less food.
So are you looking for people to sign up for this? How does someone get involved?
Well, we're lucky enough to be involved in this trial, and we're going to recruit about 70 patients. These patients need to have a BMI between 30 and 40, so about 50 to 100 pounds overweight, and they can have what we call a comorbid condition like high blood pressure or diabetes, but they don't have to. And I think you're going to provide a number, they can call that number and they'll be screened, and if they qualify, we'll be happy to talk to them. Yeah,
let's put the number up now in case someone might be interested in participating in this. 888-578-8394. Yeah, there it is. That's the number. So they call, they get involved. They'll have to go through a series of tests to determine BMI and all that stuff? Or?
Well, BMI is simply height and weight, but mainly talking to them and finding out if they're a good candidate, how serious they are about losing weight, and then we can go the next step.
Okay. Well, I think my stomach is small enough, but if I need you, I'll call you. Leave me your card.
You're looking good.
Thanks, Doc. Good seeing you. Good luck with that. All right, we'll be right back. We're going to talk about chocolate when we come back. Chocolate. That's a good segment to follow the weight loss segment here.